Good morning, everyone, and welcome to this live webinar focused on the first ever AAL programme, Internet of Things Smart Aging Challenge Prize. The purpose of this event is to provide a deeper understanding of this hugely exciting opportunity, which is making €50,000 available as a prize for the best idea for an IoT, Internet of Things, innovation designed to enable older people to live more active, comfortable, connected lives for longer. My name is William Davis, and I'm the Managing Director of Insight Publishers, a specialist communications agency working with AAL to promote all its activities, including now this innovative new challenge prize. The session today, which will last between 45 minutes to an hour, will include short presentations by our panel of experts. And I just want to run through now quickly to introduce who these people are. So we have Karina Marcus, who's Director of the AAL Programme's Central Management Unit, and a well-known face in the AAL and the active ageing scene. She'll be talking about the AAL, of course, and the context of this competition, the rising population of older adults, the market potential of innovation, new products designed for these people, and the success of the AAL programme in having delivered these exciting new products to the market. We've then got Dr. Ovidiu Vermeisen, who is the coordinator of the European Research Cluster on the Internet of Things. He's an expert, obviously, in the Internet of Things and the potential of the Internet as a whole to meet the needs of older people and the challenges they face. His talk will examine some of the ideas for IoT in this market. Third presenter is Tris Dyson, and he's Director of the Centre for Challenge Prizes at Nesta, the co-organisers of this competition, along with AAL. Tris will be looking at the practicalities involved in entering this prize, explaining in more detail just what the judges are looking for from the winning entry. So there we have the presentations, and these will be followed by an interactive question and answer session, during which the audience, and we have a very good audience attending this event, will be able to ask the panel anything they like. Just if on the practical nature, you'll have a little panel on your screen. If you just click on the question mark button, you'll be able to type in your question. And then our team here will sort through the questions and order them so we're not repeating things, and ask the panel to answer them. If time runs out and we've still got questions to answer, don't worry, these will be answered at a later date, and the results posted online on the prize websites and various other sites. But you'll get to hear about that. So make sure you ask any questions you feel will help you come up with the winning idea. Okay, so without further ado, let's start. And I'm going to ask Karina Marcus to begin her presentation and start the ball rolling. Karina.
Hello, good morning, everybody. I'd like to start showing a little bit of demographics considerations for the Europe that was provided by Europol. So the point here is everybody knows that the society is aging and that we have a lot of older people. The most important is that what the projections indicate is not only there are more and more older and older people, but also that there will be less and less people to take care of the older adults. So as you can see here, we're going from 67 or 64 up to 56% of the population that will be able really to take care of the older adults. So based on these considerations, this was in the very beginning in 2008 when the AAL started. So what is AAL? So it's an active and assisted living program. And this program is started mainly saying, wow, we have all these aging challenges. And in fact, we'd like to see this as aging opportunities. and in order really to provide social inclusion of the older adults in the society, to promote the European ICT industry, and really to have some big and good impact in the quality of life of the older adults. So it's an European initiative to fund the project solutions based on the ICT to provide solutions that really improve the quality of life of older adults. So this is really important. And also, traditionally, the activities that the AL program has been performing is really to fund projects, collaborative projects that last between 2 to 3 years with a clear market orientation and involvement of end users. So this is what is the normal context. And we had a lot of different calls from 2008. We started with chronic conditions that was more linked to health, but then we went to social interactions and service society, where it's more based on communication and services. Then mobility, to help older persons to be mobile in the society or at home. Then home care and occupational life. So we had more or less 20 to 30 projects in each one of the calls. This is already a very good point. We have very good solutions from that, and all this information is available in the AL website. In 2014, we started a phase that is more directed to challenge ways. So in fact, we have not only, it's not specifically a topic, but we had a challenge to solve. So how to care for the future, that was in 14. How to live longer and active and independently at home, so it was in 15. And we have the current call that is living well with dementia. But this is mainly for the normal calls, and of course we have a consortium with the different members, and they are working in a longer time horizon. So there was a consideration in the group of all the stakeholders in the AL program saying, well, we could think about something different. That could be a new way to fund innovation. That could be more rapid, and that really could provide quick solutions in a quick way, but really very focused approach to the market. So this is one of the things that are really, really important for us. We thought, well, there's a lot of buzz about Internet of Things. This is one of ways to move forward, to have things connected, and to really take benefit from this, to help the older persons and the society around, to provide the service to the old adults. So really, what we got at the end was this challenge statement that, well, AL program is seeking innovations in Internet, connect devices, technologies that will really empower older adults to achieve the quality of life they aspire to. So that means really aspiration, wishes in a positive and constructive way. So we're not trying to see what are the problems, the difficulties, and have a negative approach to the aging society, but really to see what they would be wishing to, what they will be aspiring to have a proper role, a proper health, a proper care. The innovations should present a business opportunity. So this is something that is very important, and that will improve the connectivity between older adults, devices and technologies related to any aspect of life, but also in this context of aspiration and wishes. Innovations must involve older adults in the development. This is something that is really also important in the AL program, in the traditional call for projects, and also in this challenge one, that is the involvement of the end users in order to have solutions that really go in the direction of what they will use and what they really like to use. It's not something that is a technology push, but that is co-designed in order really to have a solution that is acceptable by the older adults. So here you have a quick snapshot of the timeline, and we'll have the deadline on 13th May for the first one, and it all end in a very nice event that will be the award of the challenge prize in September. It will be with the AAL Forum. So what is the AAL Forum? The AAL Forum is an annual event that the AAL program organizes in order really to gather all the community that works with AAL, with this type of solutions, with older adults that really promote the social integration and the different aspects of life of older adults using ICT. And we have already organized it since 2009, different fora in different places in Europe, and this year it will be in St. Gallen, so in Switzerland, and on 27 there will be the award to the winner. So thanks for your attention, and I'll be here until the end. So if you have any other questions about AAL, about specifically the Challenge Prize, I'll be happy to answer to you. Thank you very much.
We're going to ask Tris now, Tris Dyson from Nesta, who's director of the Challenge Prizes, to explain a little bit about the practicalities of the prize and the whole issue of this exciting way of funding innovation in a very agile and quick manner. Very exciting. So Tris, I'd like to hand over to you now.
Thank you. Yes. So Nesta is a charity in the UK that's working with AAL on this, and I'd just like to say, before we go into the prize in a bit more detail about what a Challenge Prize is and what it's intended to achieve. And in essence, a Challenge Prize, which is also called an inducement prize, is a way of rewarding whoever can first or most effectively meet a defined challenge. And really what Challenge Prizes are intended to do is to identify good and new ideas and practice and connect with people who can meet that particular need. So we're looking for new innovations, new or adapted or repurposed ways of doing things that can better solve and address a social problem and meet a utility better than perhaps what currently exists. And Challenge Prize really exists to find those unusual people and people who perhaps need that additional bit of money and publicity to help promote their idea and get it to market. There's a bit of a history to Challenge Prizes, so they have been used in the past to solve really quite big problems and major breakthroughs. You'll see on this slide there's a boat and a plane, which refers to the original Longitude Prize, which was about 300 years ago, which was how do you measure longitude at sea so ships don't get lost, which was solved for a British prize. And the plane indicates your TAIG prize, which is a prize for the first transatlantic flight between America and France. Both problems that were solved by galvanizing innovators and asking brilliant people to come and address these problems and come up with new ways of doing things. But there's a bit more nuance to them as well, so they can shine a light on a neglected issue or problem, and I think more broadly in assisted technology, there's perhaps a lack of awareness of the scale of the potential market opportunity for innovators, and you know, those sort of demographic statistics that Karina was talking about are also a big market opportunity, and this is perhaps a way of encouraging innovators to look at this social problem also as an opportunity in that way, and get people to think about it. But it's also a way of perhaps prompting new collaborations, getting new people to work together on a problem or issue, and very much, as well as awarding people with prize funding, being able to make a sort of a big deal of the people who are new and are coming up with great new ideas for this particular approach, as a way of helping them get to market and generate lots of publicity and awareness about them as well. So some recent prizes that we've run is the Aging World Challenge, where we're looking for people to come up with innovative ways of reducing social isolation, and where the winner was an amazing cafe that was very high quality, where older ladies called nanas earned money by cooking really great food in a community cafe. And the Inclusive Technology Prize is another good new example where we were looking at new technologies and products that could reduce the or improve the lives of older people, which included things like new walking aids and cheap, much more effective bionic hands and those sorts of things. And so these things are a good way of bringing to light new ideas and new people. Just to sort of give a bit more detail for people who are listening who would be interested in applying, the deadline for submitting your ideas is the 13th of May at 12 o'clock. And after the deadline, all the entries are going to be assessed by a group of assessors, and a final selection of finalists will be made by our judging panel. And those 15 selected finalists will be announced on June the 16th, in 2016 rather. And all entrants will be informed of the decision relating to their idea. There will be an academy in Brussels for those finalists in July. And each finalist will be granted €500 to develop the prototype for their ideas. And the deadline for submission of those of the business plans that they'll be supported to develop will be in August 2016. And then after that deadline, all the business plans will be assessed against the criteria by a group of assessors. And the final selection for the winner will be made by our panel of judges. And the winner will then be announced on the 27th of September with a prize of €50,000, but also lots of, I think, marketing support and potential. One of the big things about winning a prize like this is the light it brings on your particular product or innovation to a potentially large customer base and investors as well. But just to give you some idea of the criteria then that we're looking for. So firstly, innovation. So the idea needs to be new, but that means that it could be adapted or repurposed. It could be an existing technological product that's been changed or altered in a way to address a problem in a slightly different way. It needs to be internet connected, which means it has to have inbuilt data and transmission capability, make notifications, and to demonstrate the potential to work with a variety of other products. Quality and usability, so, essentially these got to be good stuff. It's got to meet the aspirations of older people, and it's got to be of high quality, it's got to be attractive, and it's got to be usable, which means that it's got to be accessible for people with different levels of digital literacy. Market potential, which means that this new idea or innovation is going to scale and be used by people, so that people are going to use it, and there's going to be somebody that's going to pay for it in the longer term. And impact. So the entrant needs to demonstrate a real understanding of the situation that their idea is helping to address, and how is it going to improve the lives of older people. So that needs to be clearly explained. And then there will need to be a prototype. So you'll either need to have an existing prototype, or you'll need to have developed a prototype by the time of the academy, which is in July. So that can be ready to be presented as an opportunity to our panelists. And these are just some very sort of quick examples of the sorts of things that we might be looking for. So new tablet-based devices like the Breezy, or home kits like the Apple Home Kits, which is I think a sort of a brilliant new innovation, or Be Close, which helps carers look after older people. So it could be that it's improving people's ability to get around and improve their lives in that way. So hopefully that explains a bit more about what we're looking for. But as Karina said, we'll be around to answer any more questions. Thank you.
I'd just like to ask Tris maybe to explain a little bit more about some of the examples of innovations, perhaps, that and products on the market that have come through a challenge prize like this. Give people a sort of idea of what we'd be expecting.
So, I mean, as I said, the recent technology prize that we ran was for assisted technology. Was one of the examples was a new bionic hand, which is not obviously exactly what we're looking for in this instance, but it's an interesting one because obviously bionic hands exist, but this was an innovation in terms of making it much more affordable and easy for people to get hold of and use. And that can be an example of the sorts of innovation. It may be something that already exists, but just is beyond people's price point, and how do you make it much more affordable or cheaper? A prize we ran not so long ago for the UNDP was a bit like that as well, where we were looking for renewable energy power for off-grid refugees in Bosnia. Now, obviously, renewable energy generators exist, but the innovation was to come up with a generator that was much more affordable, easy to use, and would produce more energy than anything that currently existed on the global marketplace. So it may be that people are actually just looking at what is currently existing in this space, in the internet connected world for supporting older people, and thinking, well, that's just, you know, a bit expensive, or it's not very easy to use, or there's a reason that it's not being taken up quite in the way that it should, and we've got an idea about how that can be addressed in a significant way. So it doesn't necessarily require somebody to kind of invent something completely new. I think that's worth saying.
Thanks, Tris. That was great. And the good news is that we have Badru on the line. Just a reminder that he is the coordinator of the European IoT Research Cluster, and we'll be speaking now about the potential of Internet of Things in this space. Particularly has an Aging Alliance involved in this work.
Internet of Things as systems of systems, and the elements that can be used in different domains, including the healthcare and aging well society. And in this context, I will try to go through a number of myths that we have about aging society, well-being, and present how Internet of Things maybe it could change these myths and bring a new trend in this new economy. So emerging economies will balance out the silver tsunami of development economies. So this is again an element that we have to consider in the future for different countries, and actually Internet of Things technologies and application could reduce the costs for the population aging in the global trend. Countries with aging populations face decades of low growth. This again, it's a myth that can be changed if we consider that Internet of Things application will make easier for the population over 60 to be integrated in the new share economy. Employment in a zero-sum game, so retaining older workers will only worsen the crisis of youth unemployment. This again, with the Internet of Things applications and with the introduction of new business models for IoT and the share economy will be changed. Older workers tend to be less productive. So this again, it's a myth that will change with the use of different technologies, where actually the contribution and the measure of the products and services that are offered, plus the experience, are not any longer depending on the age. Then the entrepreneurial spirit tends to decline with age. This again can be changed using different IoT technologies and integrated these new technologies in the share economy development. Older consumers are an attractive demographic for marketers. This again in the share economy will change because older consumers are becoming more and more category that can be used in this new share economy where IoT applications will be in place. And older consumers are less likely to adopt new technology. Yes, it's true if the technology is not appealing, has a bad interface, has bad communication with the user. But this is one of the elements that will change by the introduction of IoT, which should be seamless and should be affordable and easy to use for all the customers. Then, healthcare demand. We see that we have more and more need for telemedicine, ambulatory health monitoring, fall detection, ambient assisting, and smart environments to improve quality of life. Stressor on care. Today, we see the access to healthcare system, the demographics, the cost, but technology that can improve this and can reduce the stress on the healthcare demand are technologies like IoT, cloud computing, mobile connected devices, advanced displays, and data models, data-driven models for different applications. Challenges for IoT technologies when we consider that we want to use it in the domain of healthcare for aging well are the evolution of the different sensors, the miniaturization and the integration of these sensors in the application for healthcare. And here we can say that the new wearables are one example of this evolution. Evolution in networking protocols, and here the seamless integration into a network, either it's 4G or in the future 5G, will make access to data and controlling the group of sensors and data much easier. Smart, sustainable, and inclusive environments. This we are talking about the challenge on having all the participants in an ecosystem, all the devices connected to the network and connecting in between all the time. Handling large data generated. This is another challenge that we have to consider that will be addressed in the future, where the data and the analytics that are run on this data will be in the focus. Scalable, distributed, and decentralized systems. This will help, in a way, the application in the healthcare and the use of these IoT technologies for aging well support. And, of course, the societal impact, how effectively we can use and trust the technology that will be implemented. And I will try to stop on the part related to how these technologies for aging well are interlinked. So when we are talking about IoT applications for aging well society, we have to combine the applications with other areas like smart appliances, smart buildings, smart grid, intelligent traffic, light control. And this together will make the application for the aging well applicable, and this will solve some of the challenges that we have today in this domain. So IoT priorities for this area are digital healthcare and well-being, focus on enrich citizen-centric IoT living indoor and outdoor environments through wearables and seamless integration IoT in smart buildings and homes for health and well-being. This could be a challenge in the ideas that will come for this price. And smart living environments for active and healthy aging. Again, focus on citizen-centric IoT for creating age-friendly environments, buildings, mobility, cities, to foster independent living and active aging that enables seniors to lead an active life and healthy life.
But very interesting insight there into the potential of IoT and where we're going with it. We've had quite a few questions in, actually, so that's good news. So we're going to move on now to the question and answers. Please keep the questions coming in. As I say, they will be answered, even if we can't get through them all in this session. We will answer them again and publish these online. But we'll start with an interesting question that's come in from someone in the UK, that they are from a school, and they say they'd be interested in running this as a project with pupils at school. Would we be able to submit our results as entries to the competition? And if they can, what approach would you recommend taking to get the best results for this?
I mean, the short answer is you need to be over 18, but I think we are all of us interested in brilliant new ideas and new innovations that can solve problems, and you know, the fact that for the reason of this competition you have to be over 18 shouldn't be a barrier to that. So I would suggest, if you are students and you are developing some great ideas, just make sure that your teacher or somebody over 18 is part of your team, and have them submit it as the lead person, and that will be fine. Karina, I think you agree with that?
Yes, sure. I think I have to take care of the legal requirements in the challenge prize, and but it would be really a very good initiative, because we do need well, ideas coming from all the generations, and that could also even promote intergenerational and interactions in the solutions. What would really be a good thing from what we see in a program perspective.
Thank you, Karina. But another question, though, this is sort of more practical one. I don't know who would want to answer. Someone's written in from South Africa. Is this competition open to those outside the EU? And if so, are there any special criteria for entry if you're entering from outside the EU?
So this is Karina. No, it's not really open to South Africa. So it's open to the EU member states and to the countries that participate also in the EAL program. And that means Canada, Norway, Switzerland, Israel. But outside Europe and outside these countries, it's not eligible.
Thank you, Karina. That's good. Another question then. Someone's written in from Poland. They're interested in the idea of co-creation as stipulated in the requirements for entry. Could you explain what you mean by co-creation in relation to this prize, and perhaps more importantly, do you have any examples of best practice where co-creation works best within this sort of aging space?
So, in fact, it's more or less what I mentioned in my presentation, that the idea should not really be just a technology pushed, but to have also a lot of feedback from the start, from the beginning, from the potential end users. That would be the older persons or the relatives or the carers, or whoever is going to use the solution. So this is something that we also advocate a lot in the normal projects. Best practice, if you go to the AEL website, we have some kind of guidelines. We have some toolkits in order to tell or to inform what would be the different possibilities. Of course, what we propose is more in the context of an AEL project that would take 2-3 years. But what we have here as ideas really some interactions to have really the opinion and suggestions and the wish, aspirations of the older persons, so that we are comfortable with the idea that is not really only someone that comes with a technology solution but has no clue what would be the problem or what would be really the application. So it's something that should be in the core of the idea. Is not I have a technology solution and then I want to find something to do with it, but really to work with the older adults and the persons that would use the solution in order to find something that would make sense.
I can comment.
That's good. Chris, someone's Maurice Mulvena, excuse my pronunciation, perhaps one for you here. They've quoted the entry criteria. To what extent should the submissions be user-tested and show evidence that the development of the idea involves older people in both design and testing, given the very tight timeline there is for entry? What sort of evidence are you after here?
Yes, actually, I want to comment on the co-creation part, because this is a very interesting
element. After that.
Right, because on the co-creation, we are thinking as well involve different type of stakeholders, even involving maybe creative minds, people coming from creative industry or artistic industry. At the same time, you have to involve as well public authorities, like the ones that are running the city, because together you have to co-create a solution that is appropriate for the aging well population. So this is an element that we see as the co-creation mechanism, involving different stakeholders, involving the demand and supply side. And as was mentioned before, it's not only the technology is the supply side, but we need to involve the demand side as well. And on the demand side, we have several stakeholders. One is the population that will receive this product or service, and on the other side are the ones that will provide this service, like the city, like the healthcare community, like the family members of the persons involved in the application.
Thank you very much, Ovidiu. Trish, I wondered if you could just come back and maybe answer the question from Maurice about the what evidence you required of this testing involving older people, given the timeline for the end.
Co-creation is a bit of a technical, jargony sort of term sometimes, and all it means is having worked with the older people that you're looking to create the product for, so that you understand that it's going to work for them, basically. As you would with any really new product or service, at least any new product or service that's going to work. So I would point this question about evidence to the form, but basically there needs to be evidence that you plan to test the prototype, so that you've done the sort of engagement of having spoken to and engaged with and worked with some older people, so you've got a good sense that this is going to work, and then you need to have an idea about how you're going to test the prototype should you become a finalist, and explain how to do that. If you become a finalist, then we will look to see some evidence from that testing at that point. So that could be surveys, or feedback from some end users that have used the prototype and have shown what they think of it and how it may or may not work. So the entry level is reasonably low from that point of view. You just need to have a good plan to show how you're going to do it.
Thanks, Chris. That's great. I had a question from Andrzej Pielek, who's asking what happens to the intellectual property of any innovation that comes out of this. Does AAL own it? I think it's a fairly simple one to answer. Maybe Karina?
Sure. No, the IPR belongs to the participant. And we really would like them to use it the best to go to the market and show that the idea works and have a really good success all over Europe and all over the world.
Great, thanks. It's an interesting one. Someone's written in that they've got a good idea, they like their idea, but they have no experience in building prototypes.
The idea is of course, a very good start, but we really would like to have some type of prototype. So this is why we accept ideas of a group of people. It's not in the name of one, so you can have 2, 3 working together in something. So it's not mandatorily individual application. You can have several co-participants in the same type of thing. So this is also one way to work that you don't have to do from the beginning to the end. But also in the idea is something that if the idea is good and have a good prospect and have some proofs that there will be a prototype, in the academia, there will be also some hints in order to help people to go forward with what they're going to propose.
I think very important is to add one more element. The solution should have as well a business model behind, because at the end we want that this will be, I would say, commercialized or used in practice. So from this point of view, the business model should be attached to the solution, and the solution will be mature enough, as was mentioned, at the prototype level, and shows the methods for validation of the idea and the solution. This is very important. How you validate, and we have to consider a minimum sample of users on which the prototype will be tested.
Great, thanks, Aurelia. Good advice there. So, Guy Dillon has just written in, can ideas be submitted under a non-disclosure agreement?
Yeah, so, I mean, if you look at the application form, it's really a very simple application form, and we're asking a series of questions that shouldn't really be giving away very much, to be honest, in terms of IPR. And I think if you're, I think it would be surprising if you were giving away information in that form that was, you know, in any way to your sort of competitive disadvantage. But if you were, if you did have particular concerns, I would suggest that you just explain them prior to applying, and then maybe we can take a view on it in that way.
Abdelaziz El-Urak has written in, can the idea be a software product?
We have software or hardware implementation in IoT applications, but behind the software and hardware should be a service provided to the end user, and this is very important. If the software, the piece of software, provides a service for improving the life of persons over 60, yes, but this should be actually connected with one of the devices or several devices that are in direct interaction with the end user.
The idea of a service behind it is not only the software. The software should be really the portal, the interface for a service that will be helping really to improve the quality of life of the older person.
Someone's asked for whether there's a detailed description of the expectations from AAL. Alan has written in about that. There is a website that is part. If you go to www.nesta.org.uk, there's a series of prizes listed there. One of which is the AAL Smart Aging Prize, and that will take you, they'll give you a good description of the prize, etc., and it will also take you to the application form.
Well, you can find it on the Nesta website, but you may have it may take you a while to find it. The direct domain, which perhaps we could circulate, I don't know, is aal.challengeprizecenter.org. So that's aal.challengeprizecenter.org, and that's where you'll find where to enter the prize.
Look, we've got about 5 minutes to go. I just wondered if we could have a quick round the table summing up from our panelists before we close on the hour, just as an idea to give everyone an idea of what we've been talking about, and perhaps sort of inspire them further to want to enter this competition. So perhaps we could begin with Karina again, and just a really, really quick summing up.
Thanks, William. The idea really is AAL wants to use ICT, but it's just, to use ICT, not to provide ICT solutions, but the sake of using ICT like that. So it's really to have a strong involvement or a point of view of the end users in the the idea conception. So it's not something that can be substantially new. That is something that can really provide good benefits for the older persons. So the focus is we don't want to give all the detailed prescription of what we would like to have, because this is really a challenge. It's something that is open. So creativity, imagination, good design, these are the main elements that we are looking for. Thank you,
Karina. Perhaps now, Ovidio, would you like to come in?
For us, it's very important that we have an application for IoT that benefits the seniors. And for this, behind the solution, we have to have a business models, we have to have an impact, and we have to have a high level of adoption. So very important. A technology that is not used is not worth it. So this is very important. Adoption and benefits for the seniors.
Thank you very much. And perhaps now we could finish with Tris.
Yeah, so we're looking for brilliant, fairly early stage ideas that can really scale and make a difference. And I think this will really benefit people who want to accelerate by getting into quite an extensive network, getting quite a lot of potential profile and publicity and support along the way. The entry submission form is deliberately very straightforward. There's only a few questions. That said, I would say to everybody that the questions are very important, so make use of all the available space, use links, give examples. Every question needs to be answered, properly, because we're looking at good ideas, but good ideas that we need to understand the thinking behind it and why these things may or may not work. Yeah, I mean, we look forward to seeing some, as we always do with these things, some really great breakthrough ideas that can impact on the lives of older people, which is what we're all interested in.
Thank you very much. Right, well, thank you to all our panelists and our questioners and the audience for listening in today. I think it's been a really fascinating and a very enlightening discussion. We have got lots of other questions that need answering, so we will get those answered. But the discussion, I think, it really outlines what a fantastic opportunity this is for inventors, for entrepreneurs, researchers, and startup companies out there to really kickstart their business with an idea, with cash in the bank and also expert support along the way. If anyone has got any questions that they want to ask after this that haven't been asked, please email me directly and I'll pass those on to the discussions. But I want to finish the event with a very short film that I think clearly demonstrates the passion and the vision and the optimism of the AAL community.
This is a human-to-human forum, so you network with a lot of people, you get to know each other, and you need these connections to do business all over Europe or even internationally. That's first of all. Second, I think you can show everybody here your products and your services that you have been working on for 1, 2, 3 years, and that's a great way of getting feedback.
Each and every one of us, is an expert in something, but it's really close to yourself. But if you meet and you can share this, then you just share and spread ideas. So that is the biggest value for me.
When you go to these sessions, I was in a session where the focus was on user involvement of elderly people, and there are so many nice ideas and approaches which we maybe adapt by ourselves in our country.
I've been involved and been following the AAL forum and the AAL activity for quite some years. I'm very enthusiastic to see how professional and also how in-depth people go here. and also that they can be quite critical. So that's good. It's a very good mix.
The informal caregivers are the most important pillar of all health systems. If they break away because due to burnout and stress, etc., the most important pillar breaks away. So we have to focus how can we assist to keep this pillar alive.
I think a forum like this is really important because what you're doing is giving the opportunity for these companies here to exhibit what they're doing, to have conversations with experts, and make it very iterative and have an interactive discussion where people are not just sitting listening to lectures but actually engaging in creating new ideas themselves.
To demonstrate that by entering this competition, you all have a chance to be part of this. It's a very vibrant and dynamic and inventive community. And certainly when the winner is announced at the AL Forum 2016 in St. Gallen in September, it's going to be a very exciting time. I guess the question is now could it be you? So thank you very much, everyone, for attending, and I wish everyone luck in entering this competition. It's a fantastic opportunity. And I'm really looking forward to seeing some of the fantastic ideas that come through. Goodbye.